Band failure has been reported in 12 to 24% of recent studies. Please listen to the rest of this report about band to bypass revision.
Here's a picture where you can see a gastric band being cut out and removed. And you can appreciate sort of an inflammatory rind left behind on the stomach following the removal of the band. This happens in most patients, and once the band is removed, as in this photo, you can see what's left behind and how this could be a very sort of unfriendly area to operate in because of all the inflammation left behind from the foreign body. So the purpose of our study was to examine if Roux-en-Y bypass following band removal is a safe and effective way to treat these patients. We look at a retrospective review of 74 patients who had their band removed in subsequent Roux-en-Y gastric bypass between the years of 2003 and 2010. The reasons for the removal and complications were examined. And the weight loss at 1 year of these patients was then compared to a group who underwent primary Roux-en-Y gastric bypass. The demographics of the group, there are 74 patients. There were 4 males and 70 females. The age at revision varied from 19 years to nearly 76 years. The average age was 45, and the average BMI of these patients at the time of their revision was 45. Reasons for the band removal were various. Failure to lose weight was cited in 42% of the patient group. 26% included some sort of complication, including failure. And the blue piece of the pie here is usually a combination of these factors. So someone who stated that perhaps they didn't lose weight as well as they had reflux so severe that they wanted their band removed. Of note, reflux itself was reported in 65% of these patients at the time of their band removal. And so it was considered a factor in their request to have their band removed. Band removal with concurrent revision was performed in 67 of these patients. In contrast to this, the removal with a staged revision was done in 90% of the patients, or 7 of them, and the time from the placement to the revision varied from 7 months to 86 months, with a mean of 40 months. So some people were able to have their band on for as long as 7 years before they actually required their removal. Here's a comparison of the two groups. The stage procedures resulted in a lower operative time, although they stayed in the hospital slightly longer. Their BMI was approximately the same as the people who had a concurrent revision, and they had the same age and a similar population makeup. The concurrent removal resulted in a slightly longer operative time with a somewhat shorter length of stay, but understanding that it's a small group, we couldn't draw specific conclusions as to whether this made a major difference. Complications associated: wound infection in 1 patient, pneumonia in 1 patient, and a hernia, which was through a previous port site in 1 patient. The mortality in the group was 0. The next component of the study then was to look at these groups and then compare them to a series of patients who had undergone primary gastric bypass and had not had a band previously. The control group was created from the entire group experience from this practice with primary Roux-en-Y gastric bypass. This is obviously a large group of 3,700 patients. The average age, the average BMI at the time of their Roux-en-Y gastric bypass was 48 in comparison to those who were revised, which was 45. So you can see that they didn't lose much weight with their band. Their age was approximately the same, and the makeup is slightly different. It wasn't determined what significance that had in the overall study and in what way that really truly made a difference. So then the assessment of success. The assessment of bariatric success is typically measured in excess body weight loss, which sort of levels the playing field. So for example, a patient with a BMI of 40 has approximately 100 pounds of excess body weight to lose. So losing 70% of this would represent the loss of 70 pounds in this specific patient. So like I said, this is just a way of leveling the playing field when you talk about weight loss. And here is a graphic representation of how the groups did. Patients who underwent primary bypass at 1 year had lost nearly 77% of their excess body weight, whereas when they had had a revision, they lost only 60% of their body weight. And this was a significant difference in the amount that was lost between the two groups. You could see them starting to separate as early as 6 weeks, and this actually stayed the same throughout the study up to a 1-year follow-up. In conclusion, we determined that the removal of the lap band with revision to a room-wide gastric bypass is a safe procedure, that the weight loss for those who underwent the revision was less than those who had undergone a primary gastric bypass, and that this should therefore be discussed in preoperative counseling with these patients, and that they should understand this expectation going into the surgery, that it can still be a successful way for them to lose weight, but that their overall result may not be as optimal as someone who underwent the surgery primarily. And as far as how well or how good an idea it is to do someone staged versus concurrent, still needs further discussion and further study. Most of these patients were done at the same time, and further studies could help us determine which is a better way for the patient to undergo this procedure.